Laura Tamblyn Watts is the CEO of CanAge, a national seniors advocacy organization. Ms. Tamblyn Watts, first of all, thanks for taking time to speak with me. Good to see you again.
My pleasure.
What is your reaction to these findings and the recommendations from the Patient's Ombudsman in Ontario? What stood out for you?
Well, they're not surprising. I mean, it does seem a fairly accurate series of recommendations that have come out of what we kind of expected we would hear. We heard about the lack of communication. We heard about the worries of staffing. We heard also about the terrible situation around infection control. And in the end, one of the things that really stood out, though, was that it was staff who were also reaching out to the patient ombudsman. Now, it's not really set up for that. So one of the recommendations says that there should be a whistleblower provision in the legislation so staff can safely reach out. So all in all, kind of what you would expect, but a little bit unusual to see that they're saying that staff needs a place to talk about these things safely.
I think it's a fairly damning indictment, isn't it, of the way the system was operating. And what stood out for me too was just the lack of preparation. All of these things that seemed to happen, nobody seemed quite sure what to do or where to find help or how to deal with families or some of these other key things you would think would be top of mind when a pandemic hits.
It was a scramble. There's no question about it. And I mean, we know that the associations were trying as hard as they can to get the information out, but there wasn't that communication with government. And one of the interesting things that it said was, there's a focus, of course, on getting things to hospital. One of the parts of the report said, because of that, we weren't ready in long-term care. Well, anyone in long-term care can tell you that they were crying into the wind to get the resources. Yes, it's true that we saw, challenges in hospitals overseas, but we knew that once it would come into our frailest frail in a closed setting, it would spread like wildfire. And that preparation didn't get used by the government of Ontario. And in fact, it was different in other provinces, and we had some different outcomes there.
Tell me about that. I mean, could these findings and recommendations be applied to all other provinces, or is that unfair?
No, we can certainly see some of the key issues across this country, but one of the exceptions to the rule was pointed out in this report, and that's how British Columbia responded to it. So they really had an early focus, really middle of March, where they started changing staffing, putting prioritization of personal protective equipment into the long-term care home and increasing communication. So they did a much better job, and we can see that the death rate in BC was about a tenth of what it was in Ontario and Quebec. And Ontario and Quebec did not respond with many of those needed measures well until the third week of April, 5-6 weeks after. Every one of those weeks was an increase in the curve. And so certainly we could have done a better job, and this report says it.
Okay, we saw frantic efforts to deal with the tragic outbreaks in these long-term care homes during the first wave of the pandemic. We saw the Army called in fact, in some places to help. Are you satisfied that the lessons learned from that experience and have been laid out in this report from the Patient's Ombudsman, that some of those things are being put into practice even now as we get hit by a second wave?
I think that we know what's wrong, but I don't think that we've taken the steps to make them right. So we know about staffing challenges in long-term care. That's been a well-known problem. But we had a little bit of extra support over the summer because we had nurses and doctors who were in school, students learning, come and help out, as well as in some cases the military help out. Well, the military's gone, and so are the students. And the staff that are left across this country who've been working 24/7, particularly at homes that have had outbreaks, are exhausted. And they often have children at home too, and have these extra rules about school-aged children. So I think we're going to see a staffing crisis increase, not decrease, as fall and winter comes. The good news is rapid testing is being approved, and I think that once we get rapid testing for everybody who goes in and out of long-term care homes, that will help, though.
We're seeing a spike in some cases now in long-term care homes in different parts of the country. So I guess, how concerned are you that this is going to be bad again in long-term care homes in a second wave, or you think we'll do better? You sort of touched on it, but let's drill down a bit.
I think that CanAge, our organization, is really singing the same song as others. We're very worried about a second wave and maybe a third. And often the spotlight wavers away from seniors. And so we're particularly concerned with this sort of new sense that, well, maybe it's okay that the older people who are in long-term care home actually do get infected and die. That sounds dire, but it's true. We're very focused on back to school, and for good reason. But let's not forget that we are nowhere near solving the issue in long-term care. So as attention wavers, so does funding. And we know what we need to do. We need to change how long-term care is staffed. We know we need to change how long-term care is prioritized. And we know that we need to make significant infrastructure investments. Some of those investments are being made across this country, but lots of them aren't. And we're very worried that unless people start actually moving quickly in government to address our long known concerns, we'll have significantly greater loss of life.
All right, we'll hope that doesn't happen as we watch a second wave unfold here across the country. Laura Tamblyn Watts, thanks for your time. Always good to talk to you.
Thank you.